Your health can affect all kinds of relationships, especially if you're dealing with a chronic illness. And the illness that we're going to be talking about today is diabetes. And I'm so happy to have Jumana Chaiban, Dr. Jumana Chaiban here. I hope I get this right. You are the medical director of the Joslin Diabetes Center at St. Vincent Charity Medical Center. Welcome to the show.
Thank you. Thank you.
So sometimes this chronic disease can get undiagnosed, correct?
Right.
And how does that happen?
It's just because diabetes is a silent disease at the early stages, mainly in type 2 diabetics, those who are mainly obese. So the pancreas, which is the organ that produces insulin, starts failing long before diabetes becomes frankly apparent.
Wow.
Maybe 10 to 15 years before. And that's why as doctors, we always tell the patients, you need to follow up, get your regular screening, blood work done. In case you have diabetes, it will appear on the blood work before you start getting symptoms.
Okay, so I just had my physical.
Okay.
Is there some kind of blood test I should be saying to my doctor? Because my aunt had diabetes on my dad's side, his sister. Should I be saying, I want you to check for this in your blood work?
Right.
Nobody ever told me that. Okay.
All the doctors usually, all the primary care doctors usually automatically check for a fasting blood sugar these days.
Good. Okay,
so, yeah,
that's good to know.
You should be fine.
Good. So now, once the symptoms do start to show, what kinds of things are we looking at?
I want to reemphasize again that the symptoms, the main symptom is the absence of symptoms and the importance of really getting the screening for diabetes.
Okay.
So at late stages, usually people present with what we already know, like increased thirst, dry mouth. They start having frequent urination. Some of them have weight loss. Others get some blurring of their vision. But these are at later stages when the pancreas fails.
Oh, boy. So what can we do to prevent? I know that blood tests helps, but is there anything else we can do to prevent, like head it off at the pass?
The main thing we can do, like to slow down the progression to diabetes or of diabetes, is a healthy lifestyle. This is the cornerstone, like a healthy, well-balanced diet, regular exercise. This is the main thing. And
I'm guessing that once you're diagnosed with diabetes, that's kind of what they tell you to do as well, right?
Right. This is the cornerstone for pre-diabetes, and it stays for diabetes. And it's basically for everyone, too.
Okay. Now, here's the big question. Once you're diagnosed, can you reverse it?
Reversing diabetes most of the times is not possible 100%, but if the patient, let's say, is obese and have gained lots of weight over the past few years, and then all of a sudden his blood work shows that the glucose is high or the sugar in the blood is high, at that point, if they are really following a good, healthy diet, if they start exercising, moving more, they might lose more weight with that, and hence their blood sugars might go down and their diabetes will become better controlled, we say.
Okay.
Sometimes these patients need to be put on some medication to help that.
Well, the insulin, right?
No, I mean, there are pills for that. There are so many classes of pills that we can start with.
All right.
And then depending on how bad is the diabetes, we decide if they need insulin or not.
Okay.
But we might stop the medications at one point, but people should really follow up regularly, because at one point, if they change anything in their diet or they gain more weight, they might need the medication again.
But I'm liking what I'm hearing. What I hear you saying is that really a person has a lot of control to a certain degree over how much the disease progresses.
Right. I mean, we always tell the patients or people with diabetes that the main player for the management of diabetes is the person himself or herself.
Exactly.
We're just here as doctors to coach the patient, tell them what to do, guide them to prevent the progression to diabetes and to prevent long-term complications.
Prevention, great message. Thank you so much for being here. If you would like to get a hold of Dr. Chaiban, you can do so by calling 800-834-4917 at the St. Vincent Charity Medical Center, or go on their website at stvincentcharity.com. Stay tuned, because we've got Rate Your Relationship coming up next.